Hi, it's Dr. Mark, and here today I want to talk to you about Vertiball and lateral epicondylitis, or as most people know it by, tennis elbow. Now, tennis elbow or lateral epicondylitis, it's a pretty common condition that comes from inflammation or tenderness on the lateral side, or that means side of your elbow. Now, you can certainly get it in tennis, and the reason why it's called tennis elbow is a lot of times tennis players develop pain there, but a lot of people get it also just from doing things that you would normally do in your life, like working on your computer or on your cell phone. Now, understanding what causes lateral epicondylitis will let us know what we need to do with the Vertiball to help it. So let me explain what it is and we'll take it from there. So lateral epicondylitis is an irritation or a tendinosis of the forearm extensors. So when you have your arm out to the side like this, extension is moving your wrist up just like this. That extension and repeated use over time can create an irritation of the tendons that attach into this side bone here, which is called the lateral epicondyle. Now, we can use Vertiball often and easy on the wall, but let me show you how to use it on the table to help with that tennis elbow. So I just would want to disconnect the ball from the unit, and I want to anchor it down so it's this easy. Come in, press it down, slide the ball. Now I'm ready to go. I want to get it so that I can start right on that tender area, and then as I work it, I'm going to work my way down on the forearm. For those who have it, you'll know you're on the right spot. But what I would just do is I would line up my forearm and then roll on the ball, and as the ball spins, I would want to work my way down the back side of your forearm. You want to work all the way from this bone here at that lateral epicondyle, and you want to work it to wherever you're feeling that discomfort. Now, if you want to make it a little bit more intense, what I'd recommend is to make a fist, and then this is called wrist flexion. So flex the wrist and then roll the ball, and wrist flexion will actually tighten up these lateral muscles here, these forearm extensors, and will make it a little bit more intense. I'd recommend just kind of using it for 30 seconds, a minute, once, twice, maybe even 3 times a day. Now, you can't carry Vertiball with you all day, so we want to try to complement it when we're not using it. So the stretches that I recommend for those extensors is you want to flex the wrist so that the wrist is coming down, and then you want to press your fingers so that they're kind of coming back along the forearm, so into this position. You should feel that tension on this outside portion of your forearm, and you want to hold it for about 10, maybe 15 seconds. And you can repeat that through the day when you're not using the Vertiball. So start off your day using the Vertiball, complement it with the stretches throughout the day, get back on the Vertiball maybe for a lunch break, get back onto it in the evening, and over time you should get some relief in that lateral epicondylitis. Good luck.